All right, everybody, welcome. We're going to get started here in a second. I'd like to welcome everybody in the room and those on video conference. I'd like to show my respect and acknowledge the traditional custodians of this land and the elders of past and present in which this event takes place. I'd also like to acknowledge the traditional owners across Western Australia, and especially for those on video conference, and pay my respects to them and their cultures and elders of past and present. I'd like to start off by introducing Robin Collard, who will perform a Welcome to Country. Welcome, Robin.
Thank you. I am one of the traditional owners and custodians of this land. There are many of us. And part of my family are the Bennell, Maguire and Shaw people. So as far as Fitzroy Crossing and down here to Perth and across the southwest. I'm humbly honoured to perform this welcoming ritual and acknowledge with the highest respect Nyunga, Marman, Warm, Ngunis, our men and brothers, Yorgas and Juk, our women and sisters, elders, our Mort, which is our family, and Bridias, leaders. There are three principles that we remember when we're talking about Noongar, and it is our people and our connection to land, our family and our knowledge. Ngala Buja, Ngala Mort, Ngala Karajan. So in our gathering, we remember and acknowledge our family that have walked before us. This land carries our ancestors' stories and spirit here in Noongar, Wajak, Bujang. Kaya, hello. Wanju, Nunukan Kwapadak Noongar Buja, Kedlak Nunuk Kuling Nija Buruwan. Hello and welcome everyone who have come here to this beautiful land by the great waters. We are standing on the land that is Gallop, or Lake Munga, as you would know it. Nijajinang mai wako, Kardijan wankaning wirin buja. Borna wankaning balab court, cart mindich. Welcome to the sacred ground of the Rainbow Serpent, the creator of the Noongar dreaming, and all of the stories, language, culture and knowledge that belong to this land. I bring the eucalyptus leaves to encourage not only peace and harmony, but for their special medicinal qualities and healing for Noongar people when our hearts, minds and body are sick. Ngani Jakora Kurt Jurupan Buja. I'm happy in my heart to welcome you here today. So thank you. Ngalakan Wankaning. We need to be listening to the stories of those that will be here today to connect with you about what you're going to learn. Ngalak Buja Ngani Nijajen Jining Buja Kundam Kurakura. So our land, it feeds us, it nourishes us. Our body and our spirit, not only in the dreaming, but now and in the future. So we walk on sacred ground. You're sitting here on sacred ground, that yining, and we're going to renew and connect our spirit to country whilst learning. Yurayakan, Murich Mort, Nunuk. Stand tall and strong for not only your own family, but for those that you are working with. Murich Kurt, Murich Wirren, Murich Ngat, Nunuk Mar. So our strong spirit, our strong heart and our strong self, so that you are welcome here to Perth and to bring your life-giving skills, whether it be by speaking or with your healing hands, your strong hearts and the goodness that you bring for others. Kedalak Kura Winyan Burich. Sometimes today and in the future we might be humbled and we'll be on our knees. Nunuk Murich. But you are strong. So one day perhaps we might meet in the spring and we'll stand and talk around our campfire. and sharing those stories, to play in that cleansing smoke, because that cleanses our heart and our spirit and our bodies. But it also helps when we put these eucalyptus leaves on there, because that is the spirit and the healing too that we are inhaling. So Nunakan Dukaning, Darch, Benningen, Jurapin. So yes, we might all dream of that day. And so while you share your food and coffee and meal, let that also be a space for you to learn. So we ask that the good spirits be here today, and that this ceremony is always conducted with respect and dignity. So guide our words and our hearts to be kind and thoughtful to those that we might meet in our journey of learning in Noongar, Whadjuk, Budja. Yunka, thank you.
Thank you, Robin. All right, well, I'd like to welcome everybody. My name is Katrina, or Kat, and I work at Injury Matters as the Evidence and Practice Lead. A couple of housekeeping before we get going today. Toilets are just on this door over here, out here onto the right. We will be taking pictures today, or photographs, so if you do not want to be included, just let us know, one of the Injury Matters staff. Telephones, please turn them on silent. Those on webinar, if you could mute your microphones right now, and if you have any questions, if you send those through, we'll ask on your behalf at the end. And if in case of emergency, please head downstairs and outside, gather by Lake Monger. Okay, just a quick overview for today. We will start off with an introduction on evaluation, giving a bit of a background on the state of evaluation from Associate Professor Michael Rosenberg, and then we'll focus on evaluation within Aboriginal communities with Jessica Carter from North Metropolitan Health Service, and then we'll keep a Q&A for the end. So just to give you a quick background a bit on Injury Matters, our vision is towards an injury-free community, and we work to prevent injuries and help through to support recovery. We do that through influencing injury prevention priorities, empowering those to make modifiable risk factors for injury prevention, and collaborating for effective solutions. We have three main programs that we provide. That's a Stay on Your Feet program, the No Injury program, which is why we're here today, and then the Road Trauma Support program of WA. Now, No Injury is provided through Injury Matters and funded through the state government through the Department of Health. And No Injury is a capacity building program. So we provide trainings, resources, websites, our website and resources, and then our networks to support injury prevention or health promotion, which is within Western Australia. So today is twofold. We've tried to take a bit of a different approach today. Instead of providing a skills-based workshop on injury prevention, we've tried to do a more practical approach by focusing on identifying the state of health promotion practice and evaluation, which is within WA, and then focusing on evaluation within Aboriginal communities. So I'd like to start off by welcoming Associate Professor Michael Rosenberg. Michael Rosenberg is a health and exercise scientist and director of the Health Promotion Unit at the University of Western Australia. He has 20 years of experience in community-based health promotion program evaluation and applied research on population-based prevention of non-communicable disease risk factors. Dr. Rosenberg has a broad range of research interests focused around public health, epidemiology, health promotion evaluation, children's physical activity, and the use of integrative technologies to measure and improve human health. Michael has led research into national and state level health promotion programs and on their impact. He's developed organizational level evaluation frameworks, as well as led research into physical activity, healthy weight, youth tobacco control, and workplace health community programs. He has translated his research and that of others into practice and developed and delivered health promotion programs to the community. Michael has helped others deliver and evaluate their health-related programs overall. We'd like to start off welcoming Michael Rosenberg.
Well, thank you, Kat, and welcome everyone. I would like to leave that alone. I'd like to start by acknowledging the traditional owners of this beautiful land on this magnificent day in the middle of winter. and to recognise the elders past and present. I'd also like to thank Injury Matters for an opportunity to come and talk to you, and I'd like to thank you for coming out and being interested in evaluation. It excites me to be able to talk about evaluation, and I want to take an opportunity to share with you some of my observations and thoughts about where evaluation can be focused and how we might be able to use it, as well as share with you some of the information that my group and team have collected along the way. So I thought about this title for quite a bit. I actually just had evaluation at one stage because I thought that was exciting enough. But then I wanted to talk about a couple of things, and one was reflecting on where we're up to, thinking about reframing evaluation, and then recasting evaluation in terms of what we might be able to progress. I would like to acknowledge my colleagues who have contributed much to my understanding, and to the many faces in the audience and people who I know and have worked with. So I'm going to just cover off on a few things. I'm going to at least clarify evaluation. You're here to talk about evaluation. I'm going to assume that you have some idea about what we are, but I'd like to clarify it. I'm going to present some information on the current state of evaluation, think about what we're doing well and where we might strengthen or improve, and then where we might want to go in the future. I'm going to start with a story unrelated to health and evaluation. And I'm going to talk about Alcoa. Alcoa is a company that produces aluminium. And Alcoa in the mid-80s was a company on the decline. Its profits were dropping, its revenues and processes were in decline. They had a change of executive officer. The CEO, a gentleman called Paul O'Brien, came in from a bit of a left field pick, was one of the members of the existing management staff and got promoted and came up through the company. And the story with Paul O'Brien and Alcoa is in 1987 he fronted up to a board meeting with all the media and all of the Wall Street paraphernalia and people expecting a presentation upon how he was going to restructure Alcoa, how he was going to improve manufacturing, how he was going to streamline and save money and return this company to profit. And he stood up and he said this, he said, Alcoa has the highest rate of injuries of any organisation in our industry, and the number of injuries that we have has led to many people taking days off work. I am going to focus my entire strategy around reducing injuries at Alcoa manufacturing, and I'm going to aim for 0 injuries. Well, this led to Wall Street collapsing the price of Alcoa, people thinking this guy was crazy, that he's meant to be a CEO of a company and he's not talking about profit. He's not talking about anything except reducing injury. Within 1 year of this declaration, Alcoa had turned around its fortunes. It now was making more money than it had previously. Within 5 years of making this statement, the company was valued at 5 times what it was worth. Now, the story behind what he did was really fascinating and interesting, and it has to do with what he chose, which was to reduce injuries. And the reason reducing injuries worked for Alcoa was because in order to reduce injuries, you have to change everything. So in order to make sure that no one gets injured, you have to change all of the way in which you do things, and that how you move materials, where people stand, how they access equipment. This one particular outcome of injuries changed the whole aspect of what Alcoa did. He also did one other thing. He opened up the opportunity for everyone in the organisation to contribute to this reduction. So if you were a cleaner and you saw that there was an issue with waste disposal, you could call him. He gave out his number and say, hey, there's an issue, we could reduce injuries because this is dangerous. And the reason it worked is what they call a keystone habit. It's now quite a common use in business outside in management. And a keystone habit is a habit that drives other habits. It's something that you do in which everything else has to change, or it leads to other things that change. There are other great keystone habits, like making your bed in the morning is a keystone habit for a whole lot of other things. There's a whole science on this. The point is, and the value of the lesson around our COA, is that evaluation is one of those unique type of habits that is a keystone habit. In terms of trying to change the way we operate and think, evaluation, in order to achieve it, can be one of these keystone habits. So I put that forward in terms of what I'm talking about. In terms of evaluation, we often talk about evaluation, and I'll define it in a minute, but we talk about it in relation to evidence. But what I've observed over many years is it's not just about evidence, it's about the right evidence. And we're going to expand on that a little bit, about what that right evidence is. And I see it in three different ways. There's right evidence for strategic decisions at an organisational level. And you need particular type of evidence to be able to answer those questions. You need evidence around funding decisions, not just if you're an agency that funds, but whether funding was appropriate, whether you should apply for funding, whether the funding was of value. And finally, you need evidence around impact, whether what you have been conducting or your programs have impact. So you need to be clear in terms of when evaluation occurs, how it occurs in terms of the right information that you have. Always start presentations around evaluation talking about success, because success is the key driver of what we are looking for when we think about evaluation. I put forward the keystone habit about evaluation. It goes hand in hand with success and thinking about it. When I look at this picture, you need to think about what your reaction to this particular image is. Is it successful? Was it what was intended? How do you make a judgment about the success? Being clear about what is successful is important. It's also important if we bring it back to what we traditionally look at in terms of objectives and trying to be clear about what we're trying to achieve. Well, we might just wait an hour. So success, it's a key process, and I'm going to try and convince you that chasing success is fundamental. You need to be completely dedicated to chasing the success of your program and your organisation. And I'm going to try and link those together. Let's talk about evaluation. Just a quick definition, because it's actually a really simple concept. It's really simple to do. One definition, it's my favourite one. It's the process by which we judge the worth or value of something. It doesn't need to be more complicated than that. It is as simple as what you value and you judge of whether something was worth it. But let me give you another example outside of our sector in terms of valuing something and how you do it. So in 2015, Deloitte came out with a statement which said they are going to completely abandon performance reviews. Now, I know many of you are from agencies like mine that spend hours on performance reviews, and we invest a lot of time on performance reviews. But like many other habits, they're not actually driving a lot of change or delivering in the way that they could. And Deloitte's recognised this. And so they wanted to completely change the way that they looked at how they valued this particular process. So they did two things. One is they did it weekly. They used it and turned it into one of these pivot habits. Every week the manager was responsible for making sure that people were being evaluated and monitored about their own progress or the progress of the program. But they did something else as well. They actually got rid of all of those questions about what your goals are, where you think you want to be, and they asked some really simple questions. They asked questions that were, well, if it was your money, would you invest in this program? And thinking about this person, would you spend your money employing them for a year? So they changed the whole way in which they thought about what evaluating performance meant, and they turned it into something different, and they valued things differently. In terms of conducting evaluation, they actually did things in a simple way, and we do them in a simple way. There are only really 3 components to evaluating something that you value. The first one is observation, making observations. The second is measuring those observations. They're the 2 primary things that we do. But the most important one of them is comparison. So once you've taken your observations and your measurements, evaluation is driven by a comparison. In this particular case, and in the way that you want to think about it, it's driven by a comparison to a standard of acceptability that you set. So it's what you believe is going to be a criteria for something you value or that you think is worthwhile. Now, in health promotion, like other programs, we have a whole set of criteria that we establish about what we think is valuable in terms of things like knowledge change, attitude change, behavioural changes, community level, capacity development. So we have a whole lot of standards of acceptability. But these 2 slides, observation, measurement, comparison, they're the main take-home from what you need to know about evaluation. We have evaluation taxonomies. Now, I'm sure most of you are familiar with these, so I'm not going to spend a lot of time talking about them. We have aims, we have goals, we have objectives, we have strategy objectives, or strategy activities. We have aims and goals, and we line these up with our outcome evaluation, what we think is going to happen in the longer term. We talk about impact, and I mentioned the specific evaluation, right evidence, looking at impact. Did we actually make changes at the level that we thought we were going to influence at our particular program? And that's an impact evaluation. And then process evaluation or implementation. Did we actually deliver what we said we would deliver as part of our program? So I'm sure you're all familiar with these type of aspects. Over the last few years, I've been trying to push forward an additional level of evaluation. And I've called it here, the program, called it superannuation, which is an attempt to really embed sustainability into our programs and the way that we think. Because often sustainability or superannuation is considered as a secondary component of the program, not built into the psyche of how we address whether this program, whether these activities can continue from the very beginning. And recently, over the last few years, I've tried to encourage people to write sustainability or superannuation objectives. So from the very beginning, you allocate time and resources. And I put that to a sustainability valuation. All of these objectives, aims, need to be clarified as not being pass or failure. This isn't a pass-failure scenario. Aims and objectives and strategies are all about resource allocation. If you want to change the world, you better put a lot of resources into it. If you want to have a small change, you may not need many resources. So when you think about your objectives and your evaluation of objectives, it's important to recognise its resource allocation. And superannuation, this last little bit, is dedicating resources and time to strategies that will continue the program beyond its end. I hope this takes off. There are other types of evaluations that I'm not going to go into, but there are economic evaluations around cost-benefit analysis, cost-effectiveness analysis, and most recently there's a lot of talk about social return on investment, trying to measure those more intangible aspects that our profession and you would experience about the benefits of just getting people together and things that we find really hard to measure. So social return on investment is like a cost-benefit analysis. It just opens up the door to things that are much harder to measure. They're the classic types of evaluation. So that's partly my reflection of where we're up to. Don't forget the original stories or these ideas. I want to reflect a little bit on evaluation in WA and just talk about them. These are, I wrote all these down because I didn't want to get this wrong, but these are largely just my observations. They are things that I think have evolved, observed in terms of where we're up to as a field in health promotion, health program evaluation. I think that we are very well embedded in understanding that evaluation is part of what we do. Most of us have been trained and understand that this is an important aspect. Our managers are trained, our organisations are trained. It's expected that we will have an evaluation component. That's a really positive outcome. It's a great expectation to have as part of our programs. Capacity around evaluation. There are lots of people that do evaluation, but I would argue that we don't have great capacity in people and resources that can evaluate. And when I talk about evaluation, I mean, who spent 10 years evaluating? Where are the people who have invested their career just in evaluating? We don't have many of them. I can probably know most of them, and there's not many. Now, maybe a failure on me not being able to train enough evaluators, but it's also a cultural aspect in terms of what we value in terms of positions. And capacity around this is important. We do get budgets for evaluation. This is once again a great outcome of where we have. We may not necessarily understand how much we need for evaluation, and we may underdo it, but we have budgets for evaluation. Most of those budgets seem to be, in my experience, not well formed in terms of what actually is captured by the organisation and can be used for evaluation and what people think they need to spend additionally. But once again, this is a really positive thing. It's acknowledged that we do evaluation and that we put some money aside to do it. Value. I don't know how much we really value evaluation in terms of the fundamental decisions that we use to make it. I'm putting forward with my example of our COA that evaluation is one of these really fascinating types of habits. It's something that if you value it in different ways will give you different outcomes. And I don't get a sense of how we value it in terms of profession. Sometimes it feels like it's really important, other times it feels like a chore. Lots of people get frightened by it, but valuing this whole idea of measurement and what it can be used for is a little challenging. We evaluate one program at a time. This is a frustrating aspect. There is not often a whole systematic approach to where programs fit into large organisational strategies and capacities. And it's a problem if you're trying to generate longer term community change or whether you're trying to look at how an organisation is building from one stage to the next. We often just evaluate programs one at a time and independent of other aspects of what's happening. And I think that's a challenge in terms of program. It's also a challenge to evaluate one organisation at a time and bring everything on board. So I'm not, standing up here saying that this isn't real or that it's not a result of the organisations in which we work. It's a result of the way we get funded. But it is a challenge when you're just looking at one individual program and not pulling things together. We still evaluate too late in many cases. We don't consider it from the very beginning. I consider the whole thing a singularity, which is, a point in space and time where everything is at one. You can't do programs without evaluation. You can't do evaluation without programs. But often we're doing them too late. We're trying to come in and try and measure things, which is always hard. We have lots of great theoretical frameworks, many of them being rewritten through technology and the way in which they operate, but they are important, and I'm not sure whether we link back enough to theoretical underpinnings. They're the best thing we have at predicting what happened. Tying your message or evaluation to a theoretical basis or framework helps you understand and predict. The last one is regions. If you travel outside of WA by 100 kilometres, the service, the level of engagement and evaluation drops. There is just very limited resources and access to evaluation in the regions. But when I talk regions, I literally mean Bunbury and beyond. It's really hard. We travel down there and we speak to people and they're just grasping for resources, and maybe we could do better in sharing our knowledge of evaluation in those areas. There were just my overviews, as asked by Joe, to sort of reflect upon some of where we're up to. I also want to have a look and give a little bit of evidence around health promotion projects. So, as part of some work that we were doing for Healthway, led by Clover Maitland, we looked at Healthway's health promotion projects. Between 2005 and 2015, they'd funded 432 programs across a range of different health areas and regions. And we took a random selection of 20% of them, or 90 projects, that we wanted to look at depth and understand what was happening in terms of the evidence base that was being provided. We reviewed the available evidence of Healthway health promotion programs. So we went through the files that were in Healthway and we tried to understand about what was happening from that recorded information. We looked at all the reports and notes that were gathered by Healthway and were submitted by organisations. So I just want to say that these are one particular type of grants. They're funded by Healthway. Healthway have particular reporting requirements. I'm going to present to you what we found. They may not represent other organisations. They may not represent how you practice or what is happening. This is what we observe. And I am actually sure that it does give an insight into how we're thinking. So when you look at what was delivered, program activities, this is what we got. I separated here, just at least for this part of the presentation, into overall projects and a look at Aboriginal health projects specifically. But I know that Jessica's going to talk to us shortly, so I didn't want to go too much into the Aboriginal health project aspect side of things. So here, we developed some activities, most activities, and all activities. So we're good at delivering the program activities, at least most of them in this regard. Do we achieve the project objectives? Some of them. Most objectives are met. Just about 50%. And then the rest are all objectives are met. So we're pretty good. These are pretty good results in terms of meeting objectives in real projects. More familiar with me, I'm sure, about what the reality of delivering these are. Did we do anything in terms of changing knowledge and attitude? What's the evidence? Hardly any evidence. So there was hardly any evidence collected around these projects around whether any knowledge or attitude change had occurred. You can sort of see some evidence, much evidence, a substantial amount of evidence. So not a lot collected. We then decided we didn't believe this was the case, so we went back to the projects and actually tried to ascertain whether there was a likelihood of change. So just because you didn't measure it doesn't mean you weren't doing activities. Things were being delivered. And so, was there any likelihood? Yeah, there was some likelihood. A little likelihood that they were conducted, some likelihood, a pointer, some likelihood, much likelihood, and substantial likelihood. You can see there's only 7 Aboriginal projects and a couple of them were really fantastic and it's skewed a little bit. Did we change anything in the target behaviour? Wow, we hardly ever measured or saw any measurement of changes in actually behaviour in either program. Little evidence, some evidence, much evidence, a substantial amount. So mostly not collected. Once again, we went back to have a look. Likelihood of behaviour change. So, no likelihood. So there are some activities and some projects to show there was really no likelihood of behaviour change. A little likelihood, some, much, and a substantial amount. A pretty even spread across that. My favourite, sustainability of change in behaviour. What is the likelihood of actually things staying sustainable? Just in behaviour. The type of activities that we conducted are very unlikely to actually last in terms of behaviour change. So these are like one-off activities, one-off cooking classes, one-off events. So the chances of you actually having sustainable behaviour is very limited. Somewhat unlikely, neither. Somewhat likely, very unlikely. Very likely. Hardly anything we saw across all of these projects was likely. Likelihood of the program being sustainable, more likely. These are just very unlikely. Somewhat likely, neither. Very unlikely. So once again, a little bit towards the unlikely that the program is going to continue. I reiterate about my superannuation scheme. for programs. This is where you see it coming in terms of its likelihood. Well, what about policy and practice? We're always going on about whether, we should focus on changing policy and practice because that's a sustainable bit about our programs. So what happened when we looked at the programs here? Bit better. You're kidding me. Somewhat unlikely, but neither likely or unlikely, or somewhat likely. So these were the activities. So that's just a reflection on where we're up to. Interesting. So I'm going to talk very quickly, because I've only got a little bit of time, valuation frameworks. This is the Health Department's evaluation framework. It's fantastic. It gives a great program overview. They've even given lots of outputs and outcomes in which we can look at different aspects of it. And I'm sure you're familiar with this in terms of the type of dichotomy that it has. So here are some of the considerations that you could have. You could have a good evaluation framework, you could plan evaluation, you can ensure an adequate budget, you can start evaluation from the beginning, you can take advantage of technology, you can get help if required, all things that I'm pretty sure you could have heard before you came here, shop around, get the best price, and there's more, but all of this is obvious. I'm going to pitch to you that we actually need to do this. We need to build a culture around evaluation. My favourite tagline is from Air Asia. Their whole tagline is, now everyone can fly. It's magnificent, simple, beautiful. I always say, now everyone can evaluate is my catch cry. But we need to build an evaluation culture around what happened in terms of changing the way we do things. I won't go in completely to this example, but here's another example from another industry which relates to car manufacturing. Car manufacturing was terrible in the US in the mid-80s, and then Toyota got hold of car manufacturing, and they changed the way that people manufactured on a car floor. In that what they managed to do was, every time you stopped a car manufacturing plant, it cost $15,000 a minute to stop it. So cars in the US were just kept going. No one ever stopped it. And Toyota realised that the best thing they could do was stop the cars and make sure the cars weren't faulty. They did this by doing what's called a lean management. They put the responsibility of the process into the hands of the people on the floor. Those closer to the problem get to solve the problem. And I don't know that we do that very well when it comes to evaluation, because we don't provide evaluation or feedback in a way. My other favourite example of evaluation is South Avondale School. South Avondale School in 2010 was in the third percentile of performance. Then they had a new principal, and the principal realised that there was endless data. We all have endless data around programs, but we don't really know how to use it. So within 2 years, got them from the third percentile to the 51st percentile. And he did it by getting the teachers to use the data. He got them to get the data, go into a room and draw graphs and draw figures and actually get to understand what the data was telling them so that they could respond to what was happening in the classroom. I followed this up because this is from a Charles Durham book. Unfortunately, he left and they dropped back down in 2017. I won't go through this is it. So recasting evaluation in terms of, where should we go? So this is sort of my take-home message for you about how we can use examples from other areas, other industries, about how they use evaluation. Now, I don't want you to go away thinking that we need to completely revolutionise what we're doing. That's not the point. The point is that we still have to answer to many funders, to our managers. The whole culture has to change, not just our culture in terms of how we might operate. What I hope you might take away from some of this information is that we don't have to continue to evaluate by just doing program objectives, impact evaluation, process evaluation, and that evaluation can be quite different. My tagline, now everyone evaluates. It's an important part of just thinking about who can use information to improve the project. Success. Chase success. Be relentless about success. The reason those examples worked for those organisations was because they were relentless. They did not let anything get away from determining and achieving their objectives of success. Create evidence. Use evidence to create it at all different levels. Use short cycle evidence. Use longer cycle evidence. Anything that is generated is important in terms of trying to understand what is happening. Get your hands dirty. Use data and make sure that you can use the data in a way which is meaningful, not just at high levels. Set stretch goals. Set things that are well above what you want. Otherwise, you actually won't change what you're doing. If you don't set objectives that stretch you, you'll just keep doing the same thing. And finally, appropriately that we're focusing on Aboriginal, yarning. Tell the story. The story is the most powerful mechanism for changing the culture in the way that we evaluate. If you tell your stories about how things work, then it will change as time. And finally, take this. It was my money, would I spend it on this program as the simplest outcome evaluation? I hope in a very short time I've at least given you something to think about in terms of where evaluation fits in a broader scheme of things, in how other people in other fields use it, and how I think we could change the way that we value evaluation. Thank you.
Great, thank you, Michael. Thank you for your reflections. Write down your questions, we'll hold them for the end. I'd like to introduce Jessica Carter. Jess is a Noongar woman from Perth. Her family are Haywards and Jacksons, who are originally from Katanning in the southwest of Western Australia. Jess commenced her career with the Drug and Alcohol Office in 2010 in the position of Project Officer. Following 2 years in this position, Jess applied for and was successful for the Aboriginal Health Promotion Officer with the WA Cervical Cancer Prevention Program. In 2013, Jess was appointed the coordinator of Mort Bujari Maya, or Aboriginal Maternity Group Practice with North Metropolitan Health Service. Jess is now permanently employed as the Aboriginal Health Promotion Coordinator for the North Metropolitan Health Public Health Unit. She is responsible for the coordinating, planning, implementation, and evaluation of health promotion programs. Jess has successfully completed a Bachelor of Arts degree majoring in Political Science and International Relations and Anthropology at the University of Western Australia. She has also successfully completed a Cert 4 in Training and Assessment by the EDIS Group and successfully completed Indigenous Alcohol and Other Drug Worker Training Program and Certificate 3 in Community Services Work by the Drug and Alcohol Office. Please welcome Jess.
Okay, how do I flick it?
Just press this guy.
Okay. Good morning, everybody. It's nice to see some familiar faces. So, yeah, thank you. I'd like to acknowledge Arnie Robbins' Welcome to Country. It was really beautiful and really inspiring. And I'd also like to acknowledge Michael's presentation. That was also really inspiring. So I hope my presentation gives justice and following on from both great presentations before. So yeah, just acknowledging some of the people in the room. So it's nice to come to such a well-attended training session, and I've got people in this room who I personally learnt from. So I hope I can make you proud. So just in terms of my presentation today, and I hope keeping with the inspiration of Michael, I do refer to some frameworks. We do love frameworks within Department of Health, so I hope this gives you some contextual boundaries around how you can use that inspiration from Michael and put it into context for funding and to some tools and methods. So as I said before, so I work at the North Metro Public Health Unit with North Metro Health Service. I've been there for about 2013 when I started working as I did a secondment phase as Aboriginal Maternity Group Practice, Mort Bujari Maya. And I've always had a passion in working in Aboriginal health programs. My mum works in Aboriginal health, my sister works in Aboriginal health, so just always seemed right. So it's nice to be here today. I hope you get a lot out of it. So as I said earlier, I am going to reflect on some community-focused frameworks. Michael did briefly touch on the research and evaluation framework, so I'm not sure if you are aware of this framework. Everything that I'm going to talk about today is available online, so if you just Google any of the frameworks or any of the headings and materials, you'll be able to access it. And within that framework, I'm going to talk about the methods and tools. There is a few YouTube clips because I don't really want to talk all by myself. So I hope you don't find it too dry. I'm going to, keep it quite conversational. So if anyone wants to add anything, I know there's people in the room that have done Aboriginal programs really successfully. So if we can, create conversation, I'm all for that. So I just wanted to bring your attention to the Aboriginal Health and Wellbeing Framework 2015-2030. So if we talk about at a local community level, what's guiding us within the state around Aboriginal programs and evaluation, it's definitely this guide in terms of how we develop, implement and evaluate Aboriginal programs from a state perspective. So the vision of the program is about supporting Aboriginal people living long, well and healthy lives. So the vision is, I guess, all of our dreams. That's why we're here today. But unfortunately, it's not a reality. So how do we go about using this framework to support our program planning and evaluation? So the framework itself acknowledges the importance of culture as a determination of health and wellbeing for Aboriginal people. So if you're working in this area, there's a lot of evidence, if not too much evidence, that we know that culture supports people in making changes around their health and wellbeing. So having those cultural elements within a program supports people being enthusiastic, attending, getting there, and making it culturally appropriate to do so within your activities and your strategies. Also talks about Aboriginal people's definition of health and the strengths of community, which I'm going to touch on in a second, and talks about the partnerships between services and community to encourage new ways of working together. So as we know within the state, there is a review that's happened recently around how we can better, as a state, work more effectively and efficiently within our program planning and meeting state strategies and things such as that. So it's about not using more resources, but using the resources we have well and using our partners and our stakeholders in a way that we're all working towards meeting the same goals and objectives. So I thought it would be nice to touch on what communities see as their definition of health and wellbeing, and this was stated within the Community Health and Wellbeing Framework. So it states, community is where we live, support family, maintain our connections to country and culture, and go to school and work. These factors are important in developing a strong sense of community. We need to feel safe in our community and know we can find help, including health services close by if we need them. Maintaining and developing the connections between community and services is important in developing healthy communities. So I think sometimes when we go about developing programs, we can sometimes get bogged in the day-to-day of work, especially if you're not out in the community on a regular basis. So just keeping this definition of, I guess, the vision of what you want to depict your program to achieve in terms of the outcomes and the impact. So keeping in touch with community and what's their desired hopes for the program. So this image is an example of an urban community. So unfortunately I couldn't find an Aboriginal community that depicts the same kind of messages, but it basically touches on what that quote was reflected to. So in terms of safe communities, pride and belonging, so this is a community that we all want to live in. Healthy living, healthy neighbourhood planning, established groups and networks, so there's got that community feel, there's access to healthy food, everything's, that you need and want to access is within walking distance, or there's footpaths that are maintained for riding your bikes and walking. There's active transport, so you've got great bus shelters, access to train stations. So in the ideal world, this is what we want to work towards. But we've still got a long way to go, and how we do that in Aboriginal communities is about making sure that we do it in a culturally appropriate way, but we do it in a way that we allow community to identify what they would like and go about putting that into our program planning and evaluation. So community describe health and wellbeing as a strong sense of identity, culture, connection to family, community and country. Community interaction, supporting each other, having elders to talk to, families making spirits healthy, participating in ceremony and past culture, kids playing sport and having access to healthy cooking, good food and healthy bush tucker. Aboriginal cultural beliefs and values contribute to the health and wellbeing of Aboriginal people. There's storytelling, there's participating in cultural activities and cultural responsibilities through kinship. Safe places where people yarn, listen, learn, belong, are happy, friendly and connected, both physically and spiritually, inclusive of body and mind and spirit. So individual, family and community responsibilities where people are engaged and respected of the needs to be accountable as a collective for Aboriginal health and wellbeing. So wouldn't we love to all live in that community? I know I would. So still keeping with the Aboriginal health and wellbeing framework, there are some guiding principles that they do mention that their strategies are formed underneath. So keeping in mind when you are planning, implementing and evaluating your projects, what are some guiding principles that you want to have in terms of your program? So what's going to be your vision? And within that vision, what's going to be the principles that are going to support it? So there's cultural security. So that's about identifying and responding to the cultural needs of Aboriginal people. So you're not just going to start a program for the fun of it. There's going to be something that's impacted at a community level, and that's gone about to you getting to the point where there's going to be a need for a program, or there's going to be some type of reason why it's been put onto the agenda. And I'm going to talk about a few other frameworks, but I guess I just wanted to say that keeping in mind that you want to keep the frameworks that are holistic. And in terms of health and wellbeing of Aboriginal people is everyone's business. It's kind of gets used quite a fair bit. And what does it really mean? What do we mean when we say Aboriginal health is everyone's business? Well, I think it's about identifying that we don't necessarily always need to have specific Aboriginal programs or specific Aboriginal campaigns or specific Aboriginal resources. It's about making them inclusive and having them in a way that is supported by best practice and evidence-based research that has cultural elements within these programs or campaigns or resources. Because there's been so much research done around Aboriginal programs and campaigns, there's evidence to show that when developing an Aboriginal project or campaign, it does resonate with the non-Aboriginal community. So there are aspects to keep in mind that when you are developing and evaluating projects, it's good to have an inclusive mindset to keep in mind, and also in terms of budgeting and having funding allocation. You know, if you can develop a culturally appropriate program that's culturally appropriately evaluated that can meet Aboriginal and non-Aboriginal people's needs, then you're going to it's going to be more sustainable, and you're going to have better opportunities for outcomes and impacts into the future. So talk about partnerships in terms of ongoing collaboration with Aboriginal people to create two-way transfer of skills, ensuring that Aboriginal cultural rights, beliefs and values are respected in the development. Talks about Aboriginal community control and engagement, so ongoing participation in the decision making to take care, control and responsibility of the health and wellbeing. So I guess I want to talk about in terms of when you are developing a program, and you do need to have community buy-in and gain community support. You know, having a reference group that, you know, has Aboriginal elders or Aboriginal community people that are involved in the onset of that program development, and they too have roles and responsibilities as part of that program, is going to make the program more community owned and local at that aspect. So access and equality and accountability. So align activity to the directions of the framework and be responsive to the performance. Another framework that I want to let you know that I'm sure you all are aware of is the WA Health Promotion Strategic Framework. So I won't go into too much about that. So just in terms of when you are doing Aboriginal programs and you're looking at evaluating, being aware of what's happening at a state level is always important. And in regards to research, the research and evaluation framework, so I guess keeping all that in mind, and now going back to where Michael was in terms of how you do things differently to get greater outcomes, how you be more innovative within your workings. So I'm going to go through the steps of the research and evaluation framework in terms of how you go about identifying your aim, your goals, your objectives, and what are the evaluation processes that you need to keep in mind when you are starting your project from the very beginning. So as we know, it's research and evaluation is a critical component of successful health promotion, and it's a vital step in ensuring that communities benefit from programs being implemented. It becomes an excellent resource in identifying what is being achieved and understanding what went wrong when programs don't achieve desired effects. And that we know that there is a real key to strong partnership and communication between all stakeholders. So just in terms of that strong partnership and communication, there is another framework called the C4 engagement framework that has a great tools in terms of mapping of stakeholders, what stakeholders can influence your desired outcomes, also mapping and scoping of stakeholders. So that's quite a useful engagement framework that I would encourage you to have a look at. So, as Michael said, this research framework you may be aware of. There's 4 phases within the research framework, and they're broken down to 8 steps. So I was just going to briefly go over these steps and I guess have a conversation around how we put those into Aboriginal communities. Now there is a little clip, but I don't know how we play that.
Where's the clip? Is that?
It's in my notes.
Is it attached to this picture or? Oh, okay.
Oh, I didn't know you could do that. If it's not, it's okay. I can provide the presentation. People can check it out themselves.
Okay. Sure.
Okay. Sorry, it's just me today. So, first step in terms of the evaluation, research and evaluation framework is about identifying the national, state and local context. And it's about having a broader understanding of the significance of the health issue and the program's importance and contributing to how you're going about, I guess, targeting your health-related issue. So I'm not sure if you are aware, but last year, State Government, Department of Health released first state interim public health plan, which lists improving Aboriginal health as one of its 3 objectives, which makes quite a strong statement in terms of where the state wants to see resources and attention put towards Aboriginal health. So this is exciting to see. So if you haven't seen that document, I would encourage you to see it. So there's a lot of information, statistics in terms of the current state of Aboriginal health within the state, and strategies of how we're going to target that at a state level, but also strategies of what we can do at a local level. So in terms of that national and state context, the WA Health Promotion Strategic Framework, the Aboriginal Health and Wellbeing Framework, and this document itself really provides you an understanding of that at a state perspective. At a locals perspective, part of my work is working with local governments, and we're lucky enough that we do have, not a lot, but some data at a local level in terms of, we have the Health and Wellbeing Surveillance System, which provides us an indication of people's fruit and veg consumption, physical activity, smoking rates, alcohol consumption per local government. And this data can provide some support in terms of how you know that you're going towards implementing a program in a local government area where there's a need that needs to be addressed, and taking that into mind. The data that you can collect from that local perspective supports you in identifying who your partners are going to be, who are your stakeholders. So having that local data provides you that additional weight of how you're going about identifying who your partners and stakeholders are, and gives justification to your program and why you're going about it. There's also the ABS data 2016, which is now available, which gives you an indication at a local level of average household incomes, language spoken within local communities, gives you an indication of, people's access to transport, do people have cars, people's level of education. So it's about reviewing that information and getting a better understanding of who your community is. And that information can be provided from the epidemiology branch of Department of Health, but we encourage you all to make contact with your local public health unit. So for North Metro area, that would be myself. For South Metro, it would be Anne, who's at the back. And for East Metro, it would be Milligan. Sorry, I was about to say Meghan Markle. I watched the wedding too much. So step one is getting that understanding in that context, and that is your basis of having, reassuring that you're on the right path. That's going to provide that support. So I was asked today to provide some methods and tools of how you go about this. So within the framework, it basically details out having that planning phase of why your program is needed, what your program would do, and who the target group is and that. So I wanted to make you aware that that is available. And there was a clip, but never mind. And then there's clips that have been, so there's blank templates that you can use, but there's also templates that have been completed to give you an example of, what you need to do. Step two is about assess the needs, evidence and capacity. So I think too with Aboriginal programs, we can sometimes get flooded and emotionally, taken back by what we know the problem is. And because of that factor, we may not assess and review our capacity to the whole aspect that we need to, because we want to save people who need saving, we want to help people who need helping, and sometimes we can get caught up in that. So it's about really stepping back at this process and assessing the needs. So wait an hour? Okay. So identify the needs of the target group population is important in designing the program's goals and objectives, which will in turn inform the type of strategies you select. So as Michael said, it's about being innovative with how you go about it. You want to do something new and exciting. First step, you've got to get people there. How are you going to get people there? Well, it has to be something that is comfortable to them at a level of, feeling like they're going to feel welcome when they attend. But it also has to have that element of something that's exciting, that's different, that they wouldn't do this on the weekend, or they may not have resources or funding to be able to support them doing this in any other way. So, it could be community cook-ups with someone who's well known. It needs to have that little bit of extra flair that's going to get people there. So in saying that, what approach should you take when designing your program? So here are a list of some types that I'm sure you're all aware of. So a quantitative approach in terms of measuring its quantity rather than its quality. So we're talking about how many sessions you're going to run, the participation. So we know, as Michael said, it's about keeping in mind that the one-off activities and things like that, they don't have behaviour change or long-term gains. So within that aspect of taking on that quantitative data, keeping in mind that it's not just quantitative aspects that you need to factor in, but also to other approaches such as qualitative, so measuring the quality rather than the quantity. So you may only have 5 to 10 people who attend your program, maybe 5 on a regular basis that you can really bank on that are going to be there. So within those 5 people, sometimes we can get caught up on worrying about who's not there, who's not here, who's not here. You make all these calls, you ring around, everything. By that time, your session's over, and the people that you have there, you haven't captivated their attention. So if you've only got 5, you've only got 10, well, those people are going to have the really high increased awareness and understanding around healthy eating, physical activity, smoking, whatever your topic is. Make it a challenge that within those small group of people that you have, that you're really going to want to see some changes. So we've done programs in the past where we've had Aboriginal healthy eating programs, and we've had only a small group of people, but the change that they've made in terms of they're cooking more at home, they're saving money on takeaway, because of their cooking skills, they've been able to create connection with their kids. So now their kids are cooking with them, so they've got that connection that they're having with their kids. They're losing weight, they're feeling better. From that, the kids are healthier, the kids are happier, school attendance is higher. So it has that ripple-on effect. So if you've only got a few, you've only got a few, but make those few your goal. Theory-informed, so measuring behaviour change, preventions. Practice-based, so art-based practice research. So with this one, I thought I'd mention the method of photo voice. I'm not sure if anyone's used that, but it becomes a method in terms of that your participants have access to a camera, and instead of them writing a written evaluation of their session, they may take a number of photos in terms of what they got out of that session. So it becomes quite of a creative art-based approach that can be really beautiful at the end, but also tell a story in a different way. And then empirical in terms of gaining knowledge by means direct or indirect observation and experience. So how have they gained knowledge by participating in terms of that they have gained knowledge but they haven't understood that they've had changes at home, but they haven't identified that they have those changes. So it's about having that direct and indirect observation and experience. So defining the program's outcomes and impacts activities. So this is about the activities that you're going to take to undertake the program. So the impacts intended to be achieved by implementing the activity. So I wanted to touch on here the overarching, how you're going to measure the changes that you're going to go about making, the program's hopes to bring about, and about change in the long run. So it's in terms of the impacts that you intend to achieve and implementing the activities that are going to consist of your program. So it's important to seek improved awareness and knowledge around. The program may seek to improve awareness and knowledge around what your objectives are going to be. So in terms of healthy eating, so you may do pre and post surveys. So as Michael said, evaluation needs to start at the very beginning. So you want to make sure that that interaction that you're having in those sessions or whatnot, that data is being reported at a very early stage. I've been just given 5 minutes, so I'm going to wrap it up. So in terms of SMART, so we've all heard of SMART, so I'm not going to go into that. So making sure that at the very early stages you have an understanding of what your specific outcomes are going to be and how you're going to measure them. So important. So developing of an evaluation proposal. So your evaluation proposal will provide indicators for each goals, objective, and activity, and it will summarise where the data will be sourced, so when it's collated and who will assume responsibility. Now this is very important when you're doing working strongly with your stakeholders and partners. So this is just a one-page evaluation proposal that outlines what your program goals are, the indicators, the source, but who's responsible for that. So letting everyone know who's responsible for what activity, and how that's working towards that strategy. So I thought this was a great tool. And then you want to complete the evaluation plan. So now that you've got that information together and you have an understanding of, okay, I've identified healthy eating, who are the stakeholders in that area, I've listed them down as responsibilities and all that. So you've developed a final evaluation plan. So you want to make contact with the people who you have, if they're not already involved, the stakeholders and partners, and you want to review this evaluation proposal and budget with them, and I guess get their buy-in and understanding of explanation of how the program will go about. And then here I've just listed a couple of evaluation question examples that you may want to touch on. So has the program been implemented as intended? What factors impacted on the program implementation? What percentage of the target group did the program reach? The demographic factors, as well as the level of partnership and collaboration with your stakeholders. Did that increase? How could it be improved? Were the results consistent? So during the implementation phase, evaluation data is collected alongside the implementation of the program. So collecting data as you go. Any changes to the implementation of the program or evaluation should be documented. So this is a hard one because usually by this stage our heart's in it and we've got a lot backing on it, and we may have family in the program or friends, or we've definitely built relationships with the people. So we want it to succeed, like Michael said. Success is all you've got in your mind, but sometimes that can be our enemy in terms of making sure that we don't influence the data that we're doing. So you want to take notes regarding any difficulties encountered with the data collection, or any difficulties within the activity itself, or if there's been a misinterpretation or whatnot. So it's about being honest and not being biased when you're going through that phase. So they do recommend that a person who is not part of the program implementation team be responsible for the data analysis. So making sure that when you're the program lead on that daily activity, that you're recording that data and taking notes if there is areas of misinterpretation, or if there is some concern about who's doing what role and what's their responsibility in terms of, you may have community champions who are supporting the program itself, but then they are participating. So there are some areas that can come to mind when you're doing that daily activity, but you may not necessarily think it's a big deal. Well, it is a big deal, and this is how you go about improving your program in the future. So you want to analyse the data as intended in the evaluation plan. So you had your plan at the start, and you planned it out, so you want to keep that in mind. You want to record the notes of how the data is treated and analysed, and may impact on its validity. Oh, I've got tongue twisting. And interpretation. There's some words. So the last step is the review, recommend and disseminate. So don't keep it to yourself. You did the big beat up of you having this program and that you want people to come, and now you've got this great data. At the end of the day, you don't lose. It's all about how you learn and then share. So disseminate the findings and recommendations that have come out of the evaluation. You know, you may need to do this in several formats. You know, it's great to give the recommendations back to communities. You may want to do a one-page infographic that kind of outlines, you know, not who attended, you don't want to put any personal information, but participation, you know, people's knowledge increase in terms of them as a group. So you may want to do one at a community level that's a one-pager. You may want to do a community, a workplace one that's, you know, going to be for colleagues or whatnot, or Aboriginal colleagues in that area, or people that you know working in that field. So maybe like an executive summary and just the key findings, and then you've got your full-on evaluation report. So depending on who the target group, disseminate appropriately. And regardless of the results, understanding why these results came about can make a valuable contribution to future program development. So I think we have to keep that in mind, that this isn't the be-all, well, at the start you want it to be the be all and end all, but this isn't the first and last program you're ever going to do. So how can you make sure that you capture that and understand how that came about? So don't be ashamed, miss the barriers. And this contributes to the innovation of the program for future, but also its sustainability, which we know we need in Aboriginal health. So with that being said, I'll lift you off with another tool. So I encourage you all to review the frameworks that I mentioned before. So at the top I've got the chronic disease research and evaluation framework where I went through each of the steps. They've got great tools. They do have YouTube clips that go through each of the steps. So, you know, if you've got a project group and you're working together as a team, you know, review that, watch that together. You need to have a strong understanding of what you're going to do. And then there's the WA Health Promotion Strategic Framework. And then, as I said, in terms of cultural guiding principles, there is the Aboriginal Health and Wellbeing Framework. So lots and lots of frameworks, but while you want to be inspiring, innovative, unfortunately, in the climate that we're in, money's hard to come by, so you do need to have these steps in place to be able to get the money to get funded and to make sure you have the structure to get funding ongoing. So thank you very much. I hope you found that useful. Thanks for having me.
Thanks, Jess. Thank you. All right, at this point, if I could get just Jess and Michael to hang around. Does anybody have any questions? Any questions off the top? Yep.
We've been working with Aboriginal people down in the country area and implementing evaluation questionnaires. And
Can I?
oh, sure. And we believe that you can't really do an evaluation at the beginning and the end of a project which is basically based around yarning and health promotion, because for Aboriginal people you have to build a relationship, trust and respect between one another. And so if you try to put a set of questions before your participants right at the beginning, you won't get honest answers. So we found that a bit of a dilemma, and we ended up deciding that we would only do evaluations at the end as a self-reflecting approach. But we're quite new to this area, so we really appreciate some advice. Thank you.
Yeah. Do you have any feedback? Yeah.
Good question and good point. I think there is a fine line between how you have a detailed project plan that has the evaluation components, but also keeping in mind building that strong relationship and trust so that they, you know, return or do feel interested in coming back and having that connection. There are some strategies that I would suggest. So in terms of about getting an understanding of what their knowledge or understanding is on the topic, so not so much what they got out of the session itself, but what's their knowledge and awareness on the topic that you're talking about. So there is, I guess, some concern with Aboriginal people that they don't want to provide feedback that may be upsetting towards yourself. So they don't want to say, oh, I really didn't like the session, didn't really answer my questions or whatnot. So how can you do that in a way that's not confronting? Would be around, I would suggest, awareness and knowledge basis. Or also there could be opportunities for you, for yourself, to be able to take notes of what are some of the things that came up, and at a later stage you can revisit that information and say, you know, in the first session we talked about this and that. Now that we've got that relationship, you know, what did you think at the start? Was it what you thought it was going to be? So I think it's just about being creative with how you go about that. But yeah, I would say at the first initial start, the key is to building that relationship and trust. You don't want to be too formal. You do want to have that kind of yarning, relaxed atmosphere. I'm not sure if Michael has anything wanted to add to that.
At least three components, some of which we've touched on, which is The first is authenticity. The second is time, because things seem to have a different time frame in terms of how things are. And the third is probably empowerment. So in a lot of my experience with Aboriginal work in terms of pre and post testing and trying to gather information, it can be done through yarning. Often I try not to use surveys in a traditional way. If I'm going to ask for information, sometimes it's with the local community or someone from within the community who I can empower and train to help collect information. Most recently, I probably used techniques like photo voice, where I have provided Aboriginal people with cameras to take photos of their experience, and then to use that as a way of getting them to describe and think about what's happened, and constructing evaluation around that structure. So there are different ways to collect. I would challenge the notion of what is evidence in terms of what you're able to demonstrate, what you are required to demonstrate to show that your program has been successful. There's no point asking or putting any instrument out there that's not going to work or that's not going to provide you with the information that is required. So I agree with Jess. There are creative ways, but it's still very challenging. But trust is probably the big one.
And you may want to try use your barrier as a way of engaging. So maybe putting it forward to them in terms of, having a list of questions on, and the next session, do you have any ideas or thoughts of, what would be of interest to you? So giving them that, building that relationship in terms of, and also putting yourself out there in terms of, I want to be able to meet your needs with these programs. So, having them choose a recipe with healthy eating, talking about physical activities, has anyone done yoga or something like that, and kind of keeping it, would that be something of interest, and say, okay, we could do that. So then you kind of also too get a little bit of commitment within that technique, which might be useful.
Yep. Oh, we're going to head the mic over to you.
I would like to ask a question, Michael. You mentioned how in care when we do evaluation, we could not find evidence of change, and then we try to look at likelihood of change. So could you give us more insight or example how we go about finding likelihood of change instead of finding in case we could not find evidence of change?
You mean in terms of the program that you're running? So the difficulty in finding evidence of change within your program?
And how you go about assess the likelihood of change instead of finding evidence of change.
I'm not quite sure I get the full context of what that program or what your program is referring to. But if you're asking if it's difficult to collect evidence to get surveys or completion, what other evidence is there that things have changed? Is that?
Yeah, some of it. Because in your presentation, you assessing likelihood of change. So what actual example that or you can share with us?
So examples of evidence of change?
The likelihood?
Oh, in terms of the likelihood of change.
Yeah.
Oh, okay. Oh, sorry. Yeah, so when we looked at the likelihood of change, we were looking at the strategies that were being put in place and going back to the evidence in the literature to say, well, if you provided people with opportunities to participate in a program for 6 weeks, and in that program they were doing physical activity and nutrition, the evidence would suggest that there is a likelihood of change in the short term, but longer term change in those type of programs is more difficult. So that's what we were basing our likeliness of change in terms of individual programs when there wasn't any evidence, and we were looking at the type of strategies that were put in place and then determining whether those strategies were likely. One-off strategies, unlikely. Community events were unlikely to create a change in behaviour. They're more likely to change knowledge and attitude, but less in behaviour. And it was the same with the policies and practices, where the type of programs that were being put in place were really going to change the way an organisation operated. So, for example, sometimes funding came in and was just to demonstrate a program, but there wasn't really a lot of effort to embed that program within the organisational structure itself to change the way the organisation worked. So the likelihood of that being sustained once the funding is removed is pretty low. But programs that were used to enhance an existing program, to increase the reach into a new population, were more likely to be sustainable, because you were simply building on what already existed in the practices. You were just getting more people involved. So I think that's what.
Just on the sustainability issues of evaluation. So if you're looking at trying to change behaviour in people, how or when do you determine that that behaviour has become sustainable?
So we actually define sustainability at a number of different levels, but primarily 3. So you're talking about what I would consider the first level of sustainability, which is individuals participating in a program who have sustainability or an impact on their knowledge, attitudes and behaviours. And we know that at that level there's a decay effect in relation to behaviour. Some people take it on board and completely change. But from a sustainability perspective, we're not really looking beyond what happens at the individual level from a resource implication perspective, because we can measure that and we know what is happening. The second level of sustainability is the program level sustainability. So that's where a lot of the resources around trying to ensure that the program continues and is embedded. And so what strategies are you putting in place to try and convince organisations that this is something that they should take on? How are we going to fund this program when the funding runs out? So they're the second level of sustainability. And then the third one is the policy and practice one. So can we actually change legislation and policies and practice?
But if you're providing, so we provide training, how do we persuade people to embed the program if you can't prove the sustainability of the training on people's impact back in their workplace?
So often, well, let me answer that in a couple of ways. One is that if you are trying to put a program in place that doesn't have any evidence of sustainability from other work that's being done, probably need to look at the type of strategies and activities that you're using, because there is evidence of how to construct a program that will allow those sustainability activities to occur. So most of what when I look at it, it is, well, these are likely to work. We know that that's likely to work. So we are banking on the fact that we don't have to prove that again, because that's a research realm. And you don't want to be involved in research because that just is a completely different space. So hopefully it's a translation of the research. Sometimes there's a challenge in terms of, well, the research was done in one particular setting. Does it actually work in my particular setting? And you might decide to invest more in evaluating whether some of those sustainable changes actually occur in your population. But you would reduce the rigour. So what you're doing is you're not saying, I don't need to have a randomised intervention trial for this. I just need to follow people over a longer period, just to make sure that things are being implemented and people are being sustainable. But it becomes much more complex, and I'm not sure it works. And I would once again go back to my more current thinking, which is you have to empower people at the right level to have information. So why not give information back to people and participants, or those closest to where the problem is? And those closest to where the problem is in those type of programs is either the people themselves who are involved, or if you've touched them and you're setting up groups where they come back or there is an engagement, how do we get information back to people at that level so they can address some of those sustainability issues? But that's a different way of using the evaluation.
Thank you very much for that. So I don't know if we're jumping the gun here in terms of if Injury Matters is planning a second event around evaluation with Aboriginal communities. Is that not yet? Okay. Because it's wonderful hearing the frameworks and the overview of how it's done. We have lots of regional education officers that work at Cancer Council WA that are actually in the regions, and they want to do more in evaluating with Aboriginal communities. There's various challenges and barriers that have been touched on, whether it's regional vastness and areas and cultural appropriateness. I'm wondering if or where we can get our hands on lots of examples of evaluations that are done throughout WA. So, Michael, you talked about the wonderful example of Alcoa and some of the other examples, but where can we find really good examples throughout Western Australia where we can learn from some of those challenges and learn from how some of them are overcome and just build our knowledge and capacity in that space?
I'd like to answer that. Nice question, Cassandra.
Because I think we also, not all programs are published in journal articles, and there can be barriers around that as well in terms of ethics and things like that. So, where can we find that information?
Yeah, sure. So I encourage you, depending on where you are regionally, and to make contact with your Aboriginal Medical Service in terms of what programs that they've had run in the past and if there's opportunities where they have been evaluated. So it very much goes back to, what works at that local community level. So I would make touch with Aboriginal Medical Services, also public health units within a regional aspect. So if you want to touch base with Country Health, if they've got any examples that they're willing to share and what works for them in terms of how they go about service delivery. We do have some examples that I'd be happy to share with you. Michael did evaluate a program of ours called Nalak Kubang a couple of years ago, and he did a great evaluation of that project. So I'd be happy to share that.
Well, I would say turn to your right 2 seats down from you and let Lynn tell us some amazing stories about her program. So
I think there's some fantastic examples out there. I'd love to bring them all together, and if it's something that Injury Matters Cancer Council would be happy to host something.
The things that fascinate me most with the stories that I'm telling you are that they are fascinating stories, and underneath them is a great explanation as to why they work, and try to translate them into our field. I think there's lots of valuable lessons, but we have lots of wonderful stories, and Lynn has many herself, as will other people, and just to hear them and then try and determine how you can apply that in different settings. I think redefining how we generate evidence and how we use it is the first part. And I agree with Jessica, there is taskmasters that we have that have a culture of how they want to see evidence, which is now why we're all doing social return on investment, because that's now the new buzz way of determining whether things are of value. I think there is much merit in pursuing the stories and understanding what's actually undergoing the change. Ultimately, the people who we're serving, the community, and the funders want change. They want behaviour change, and they want people to improve the likelihood of being healthy. And if we achieve that goal, I don't think anyone will care how we get there.
And there is a resource website called Health Infonet. If you have a look in there, they've got some evaluation of programs that are really interesting. And so I'd encourage you to look there as well.
Yeah, thank you. I think that's noted, and it's something we can continue the conversation. Going on. I want to give a big round of applause for Jess and Michael. So thank you. I'd also like to give you a bit of a thank you. We have a donation on your behalf to Oxfam. So thank you both for taking the time. Yeah, so thank you. And hopefully if you could hang around after, if you have a little bit of time, we do have a morning tea where people can network and chat. So if you could hang around, or yeah, everyone. I'd like to thank you for coming today. We do have a list of trainings up on our website, and I'll put them up in a second. If we do offer other trainings within this area, but also with our road trauma support and Stay on Your Feet program. If anybody has any questions, we do also have resources, a couple outside, some example resources that we have, but otherwise, thank you. Yeah.